Okay. Hello, everybody. My name is Xavier Arriaga. I am a health science major, and this is my essay. Um, I couldn't get Zoom to work, so I'm going to screen record it and submit it to YouTube. That's why it looks a little weird because I'm recording off my phone. But this is my essay. I chose the topic, the importance of preventative healthcare, and in case you're curious of what that is pretty much like screenings and checkups. That's kind of what preventive healthcare is. It's to make sure your body's okay. And I thought this topic was pretty cool because it's kind of overlooked. We mostly hear about treating illnesses, but this is kind of the first wall of defense in a way. So this topic is really interesting to me, so that's kind of why I chose it. So I'm gonna start off with my abstract. I started off writing my abstract, which was I tried to make sure that I had a lot of information based on the paper that I was gonna write, and it kind of goes over what my paper is about. Gives the reader, a good overview of what they're about to dive into. And yeah, after my introduction, it is a full page long, and I kind of go over what preventive healthcare is and how like chronic diseases such as some we can name as cancer and heart disease are very common in Americans, and all these diseases can mostly be preventable through lifestyle changes and vaccines. Yeah, so I kind of go over stuff like that, and then I kind of go over what preventive healthcare is and like how it works pretty much. I use some sources. My first source, Dora and Srivastava. I mentioned how U.S. adults don't receive preventive services as a whole, and how I argue how their deaths are mostly common due to not having these preventative services. And yeah, I argue some more stuff here, and then I give solutions, how we can improve, like addressing the challenges. And yeah, so this is my first point, the importance of preventive healthcare. Kind of goes along with my introduction. I give my second source by Kaplan. I say that there's a lot of legal issues and troubles that go along with this, such as the Braidwood Management versus Becerra case, which threatens to undo the Affordable Care Act, which could affect preventive health care, which is not good. This would probably decline and burden the healthcare system. I mentioned also that free preventative care isn't a benefit, it's a lifeline for people. You can't pay upfront for service that could save their lives later. You know what I mean? So that pretty much is just stating that preventive healthcare shouldn't be a luxury. It should be a basic human need, because a lot of people could save money by getting their disease diagnosed before it gets chronic or pretty bad. So that's kind of the value of preventative healthcare. Moving on to my last source, I used Dora and Srivastava again. How they argue that a lot of sexism is occurring amongst women and women, and it remains inaccessible for certain races. as well as geographies, which kind of leads to my second point, which is social disparities of preventive healthcare. So, I mentioned how an ethnic group such as the Asian Americans, they face unique circumstances. Um, their populations face barriers, and they don't really rely on preventive healthcare services. I also mentioned how geographical factors also affect preventative healthcare services. In rural areas, we can see that they're less likely to be using these facilities because they're probably uninformed, and there probably isn't really any preventative healthcare services in their area or any hospitals to begin with. I mentioned area in the Appalachias, part in the United States, where it's harder to get preventive healthcare, but the quality is higher when you go to those services. Yeah. And then I go to my third point, which mentions structural sexism of preventive healthcare and how gender inequality affects preventive healthcare. And I use pretty much what I talk about in this one is sexism is like states that have higher structural sexism are less likely to receive or go to preventive healthcare. There's this thing called the gender theory, where men, since they are believed to be stronger than women, they'd rather not go to these preventive healthcare systems, checkups, rather than women do, because it's seen as less manly, I guess. So that's another thing. I mentioned more Dora and Srivastava. I mentioned Mercenik. I mentioned how addressing the sexism requires interventions that can reduce these economic barriers, because we're seeing these men suffer due to them not being comfortable and being suppressed socially. So yeah, this is pretty much what I talk about in this text. Moving on to the next one, I address how healthcare disparities in the U.S. are affected. And I mentioned again the Appalachians. I mentioned how a lot of people there, they don't really go to these places, and they could probably get stuff like corneal cancer screenings and weight assessments. The performance is better. It is mentioned that when these preventive health care are good, but there aren't really many due to these geographical barriers. Rural areas as well, especially for older patients, they're also affected by this. Socially as well, because it's mentioned in southern states that older people, especially adults, well, it is adults who live by themselves lack social supports. So, like, there may be preventative healthcare services near them, but since they're so socially, they don't have anybody to depend on socially, they don't really go to them, which sucks, because they don't have anybody to care for them, which leads to these people that are already more likely to be caught with a chronic disease or diseases are more likely to actually get them because they're not going to these preventative healthcare services. This is kind of what I mentioned on this part. Then I go to my economic impact. Kind of just mention here how It's how these preventive healthcare services can impact the economy, because I mean these are like frontline defenses, because I mean you got to think about it, right? If these preventive healthcare services are helping people, the hospitals are saving money for not having to do heart operations or doing like prolonged hospital stays. So this all kind of goes hand in hand. I mentioned also the ruling case of Braidwood versus Becerra, um, and how losing these free preventive healthcare services in states can worsen these health disparities already. It's already being seen worsening in um, health communities, in such as like the Asian American communities. So if we lose the case, who knows what would happen. And then I mentioned my main takeaways, how early intervention can reduce long-term financial burden on these healthcare systems. I mentioned like a lot of lessons that I've learned when I was researching through all my sources. Yeah, I go over all the important things that I learned, the takeaways. And yeah, I mentioned a lot of sources here. It's kind of like it's kind of over like an overview of what I just explained, and just kind of putting it together. I mentioned all the stuff we mentioned before, and then I give my take on it. And then lastly, we have our conclusion. I kind of argue how people may think that this isn't a big issue since it's not urgent, but I mean, this is pretty much the first stage. And if we really want to improve our healthcare in the United States, we got to go to the root. And this is the root. So that's pretty much what I'm mentioning. If we make this a priority, we can improve healthcare. We won't have to have people fighting for their lives last minute because they didn't know they had a certain disease, such as cancer, where it gets diagnosed in late stages. So that's kind of where the value of preventive healthcare service comes from. That's why I was pretty much interested in explaining this topic. Yeah, because I'd say a lot of us we overlook stuff like this, and like we don't even know like how powerful these services are. It's maybe like 10 minutes every single month. It could change your life completely for the good. That's kind of what I talk about in my conclusion. And yeah, these are my references. My references here. And yeah, that's pretty much what my essay is about. Thank you.